Good morning, everybody. It's great to be in Joburg, and it's excellent to see such a good turnout. I think this is multiples the size of some of the other venues. So I think you've had this morning quite a lot of interesting discussion about how the world is changing in terms of technology, data, how the workplace is changing. So we've been going through a similar journey at Alexander Forbes, and in fact, Anna goes back, 5 years with the first benefits barometer.
Yeah.
So I think it's been 5 years, and little did we know where we would be today. When we were sitting back then designing the first, because I go back to that first book, and it really was a thick publication. I use it.
By the way, there it is. Right there. There's the latest one right there. It's still thick.
But I think it was an important starting point, because up until then, I think the way that employee benefits had been done had been very siloed. It was, I've got my retirement benefit here with my retirement specialist. I've got my healthcare over here with my healthcare specialist. But there were lots of gaps in between that we were actually missing. So Benefits Barometer actually highlighted that, and through the last couple of years, we've refined that research. Some of you in the audience, and we thank you for helping us experiment, do various things to see what actually works in connecting the dots. So what I'd like to share with you today is really how we've realigned some of the offering that we provide at Alexander Forbes to help you, deliver on employee benefits, some of the key insights that we've got. And again, it's going to be a journey going forward. We've restructured how we deliver. We've restructured some of the teams. So we're very excited to be, in this next chapter of our journey. Our starting point, though, is let's go back to what we're trying to achieve, the why. So we need to have a look at what's actually going on. And many of you are sitting here today after the announcement of the Reserve Bank, from last week. Interest rates have been reduced. Everything's great, but it's not great. If you have a look at your employees in your workplace, you're seeing people suffering from financial pressure. We've got the sandwich generation. Any sandwiches in the audience here? Any future sandwiches? So I'm probably going to be like a double burger or something.
A Whopper.
The point is, the whole dynamic is changing in terms of demographics. People are having to support their parents and then children, and probably in future children's children and so forth, because of various things. And we're starting to see it come out in social unrest and issues. We're also seeing, and Anne touched on it, on individual responsibility, the move from defined benefit to defined contribution. When my grandfather was in the workplace, he stayed there, for 40 years. And when he retired, he was part of a defined benefit scheme. He got post-retirement medical aid benefits. It was a very different world. Then we put the responsibility on the individual. People started moving around, and you saw all the big changes that took place. But we didn't adjust. We didn't provide that extra support through the workplace for individuals. So what we've done over the last 5 years is refine and what we can actually, and what would actually work there. Household debt. This is a major issue in South Africa. A lot of people would say it's getting better because we were sitting at 86% a couple of years ago. Now we're sitting at 74%. It's actually not better, because in that 74%, the number of, let's call it bad debt, where it's unsecured lending, high interest loans, has actually increased. And you'd probably be seeing it in your organizations through things like garnishee orders. We all know what happened with the state, the old age grants, and that whole story. It's happening in the workplace. Household savings, we're actually dissavers. We're disinvesting. We're not saving as South Africans. And the cost of living is going up. And this is not just for the low-income earners. It's for everybody. More recently, because of taxes increasing, everybody knows that. Even your expats are getting affected these days. It's across the income spectrum. People are feeling the pinch. And we're starting to see it. You would see it in your organizations through increased potential disability claims because of stress, because of various things. You would see increased requests for people wanting to withdraw their money of retirement, not wanting to preserve. We've seen it come through in claims experience on healthcare. As people get more stressed, we all blame the healthcare industry, but actually a lot is to be said of the impact of debt, money matters on financial stress, which leads to things like problems with health, needing to go to the doctor more. That increases utilization, and that then increases costs and so forth. So you'll see it across the board. And then the last thing you've talked about this morning is the changing landscape and the future of work. The future workplace is going to be very different. It's already starting to change in many ways. So, why is this important from an employer point of view? And when I say employer, I mean it's the employer, it's the retirement fund, it's your healthcare scheme, it's your post-retirement medical, all of those things. We need to bring it all together. The bottom line is it impacts the bottom line. It's not just the individual's bottom line that is impacted. In the old defined benefit world, the employer was directly impacted when there was a deficit. Well, the deficit didn't go away. It just became invisible. But now I think that's starting to come to the surface. This was a study that was shown earlier this year, and there's a lot more research that has been done to quantify what the impact is on the bottom line, and it's becoming a lot better and a lot more refined. This was a study presented to the Society of Actuaries in the US, and it showed for 1,000 people or more, by changing financial wellness, which is really a measurement to see how well prepared people are in dealing with their monthly finances, to absorb risks, etc. There's a whole lot of mathematics behind it. If you improve that, and that goes from a score from 0 to 100, by just 10%, annual savings of 23.3 billion. What does this mean? It means that currently, if you look at South Africa, there's a big deficit. There's a big deficit in terms of what's happening at the employment place. South Africa is a deficit. We're seeing it in our GDP rates. But for you, there's also a deficit. It's just been invisible up until now. So how do we start changing this? And many of you would be here over the last number of years. We knew about this, right? We looked at our funds and we saw people aren't saving. They're not preserving. Let's give them more communication. a bigger member booklet, a thicker one. And again, explains things very nice. Unfortunately, we've actually learned that a lot of those interventions that we applied in the past don't work. What we have learned over the last 5 years is what works, and it's not perfect. There's still a long journey for us to go here. But this is a study that was done by Mercer, and the good thing, I think, for everyone here is that we're linked into the Mercer Global Research on Financial Wellness. And a lot of our thinking is shaped by what happens in other regions, but we then have a look at how we can make it applicable to South Africa. What they constructed here was two things: the Mercer Financial Wellness Index, which measures, as I mentioned earlier, people's ability to manage finances, deal with shocks, etc. And then what they call the Mercer Financial Courage Index, which is an index that measures people's courage to deal with financial matters. And what they found was that financial literacy does not improve financial wellness. By knowing how you do the calculation, compound interest and all of those things, makes no difference. What matters is financial courage. So it's psychology, and we're starting to unpack that. And that's why we use a lot of techniques in the programs that consultants have recommended to you, to use behavioral finance techniques, to give them those nudges. For example, who here has got a default investment strategy in your fund? Most people would have. And you know that works. The majority of people actually stick to defaults. And because it's got built-in long advice that helps people manage those shocks along the way, manages behavioral patterns, that's an excellent example. So we've actually uncovered many more interventions that can do that. But it's all about psychology. It's not about getting the technical detail right. It's about psychology, and that's why Mercer calls it inside employees' minds. So I think that's what we're trying to do through what we're providing through our financial well-being program, to get inside people's minds, to help them, to understand them, and look at the things that actually matter. Bottom line is that if you look at financial courage and you improve that leads to improved financial wellness. That leads to improved bottom line for the employer, for the fund, for your medical scheme, the healthcare costs, and ultimately would roll up into improving things at a country level. So how do we have a look at financial courage, and what can we actually do practically, both at a fund level as well as an employer level? So what Alexander Forbes has done is we've re-looked at how we position our teams. We used to have your retirement fund consultant, healthcare, etc. Everyone works together as a team now, both for employers as well as for individuals, and I'll unpack that a little bit more. But the starting point is to try and give the employer some analysis to have a look at what is the status, as it may be, on your employees. And this is a tool that was developed it's been in various iterations over the last number of years, and it's something that we are looking to make available to clients over the course of the next couple of months. This is just a demo to give you a taste for really what's to come. But the example here shows you we're looking at financial well-being, very important. Up until now, you've just been looking at your retirement. Everybody here has looked at replacement ratios over the last couple of years on your funds, right? Well, this goes a lot broader than that. And you'll see how these things are interconnected to each other. But our starting point is to recognize that there's no such thing as the average. Everything up until now has been designed on the average fund, the average contribution, the average healthcare plan, the average. It doesn't actually work, and dynamics are changing, as Anne and Ayabonga pointed out. So we analyze individuals, and we bucket them into groups, different generations, with different needs and behaviors. And here's just a sample of what's here. And you can see in this specific scheme for Acme Inc., there are more females than males, so it seems like they continue to take over the world, as we know. But there are 1,742 employees, most of them at the younger end. So it's very important when you're looking at your employee benefits to focus on what matters to those specific areas, and not introduce things that are not relevant and going to have the impact. What we then do is we measure three things, and data has become a lot more easier to manage, to analyze, to measure these things. In the past, we just analyzed your retirement data, so replacement ratios. And where we had the healthcare services through your consultants would analyze healthcare, which schemes, what options are being taken to see if it's optimized. But what we've now also introduced is to measure individuals' financial capability, where capability is really the ability to make money management decisions in a nutshell. And we use various measures for that, some including how indebted are individuals, and then also using through various surveys to measure their financial courage as a leading indicator around the psychology. And we bring it all together in one platform, in one analysis, so that you can see where the most important touch points and issues are. So here's an example for the different generations. The overall financial well-being score you saw was 63 out of 100. It's not great because we're trying to achieve 100, and there are various benchmarks to get you up there. But you can see for the younger employees in this specific, for Acme Inc., the financial well-being is at the lowest across. So if you wanted to focus, that's where you need to focus. And if you have a look at where's the lowest score is on financial capability. So before you start communicating more about retirement benefits, about even healthcare, you can see the healthcare is actually pretty good in this particular instance. The big area where you're going to actually make an impact is on financial capability. And that is looking at how indebted are individuals. And there's more detail behind this analysis where you can actually show across the organization on a summarized basis how indebted and in which areas people are indebted. What various salaries, and what's very interesting is that it's not what you would assume at, for example, the blue collar workers. It's across the spectrum. And in many cases, individuals that should know better, but fall prey to what's happening out there. They get sold things, credit life, various other things that are. So what you can do as an employer, you can actually then target interventions to address the issue. another leaflet, newsletter, not going to work. But you can actually have targeted interventions to now improve financial capability, solutions that will improve that, improve financial courage. What's interesting is that is a leading indicator. If you improve that, our research will show that you will automatically see an improvement in your retirement. Why? As people's finances get managed better, they free up those finances and you teach them a lot of the right behaviors through the defaults that you've put in place, because you can have contribution levels in your funds. You can also have automatic contribution escalations in future. You empower people to use those options, which that then leads to improved retirement score, that leads to an improved financial well-being score, which ultimately leads to better productivity and improves the bottom line, not just for individuals, but for the employers, for the funds. For years, we've been putting these funds together at great expense, but we're not going to the root of the problem. This tool actually allows you to drill right down into it. And what's interesting is it varies from organization to organization. What's true for one is not for the other. So it's very customizable. I was trained as an actuary for my sins. But for those people that were wondering, what do actuaries do these days? There's no more defined benefit funds. Well, this is what we're getting up to in terms of using data analytics capabilities to analyze and look at what levers one can pull, to have the right impact. So this is just a summary, and you can see. Sorry, the previous one was also you can compare to your industry. So you can see for Acme Inc., overall scores not too bad. It's similar to, if we go back, it was 63, right? Not, it's okay. It's a bit less than the overall industry. But what's very interesting is that look at the retirement score is far lower in this particular example, and it's because in this scheme they have low contribution options. But a big thing is obviously the financial capability. So that just shows you, where you could focus on. But in this instance, we recommend to the employer definitely focus on financial capability, because that's where you can have the biggest bang for buck and what you can do. So you'll be asking yourself, well, this is all great. So what does it mean, for the employer? We then translate it into 3 different measures, which you can actually have it's predictive analytics. So if you know what these different measures are, through research, assumptions, and my actuarial valuation, we can actually estimate what level of absenteeism, presenteeism, and the impact on detachment. Absenteeism is when people don't come to work. Presenteeism is when they're there, but they're not feeling great in terms of being sick and reduced productivity. Detachment is a big one for finances, where people are worried and stressed about finances, that they're rather focusing on that. And the guy who's going to come to their office with a baseball bat for that loan, that's what that's all about. The bottom line is it impacts the bottom line. And this is a measurement that tries to predict and estimate that. And for this, and again, it's for the different generations and the different member profiles. And the total lost productivity for this particular employer is 66,000 hours each month. Now, the important point is not the individual number, it's the relative number. Relative to industry standards, this one's very high. It's very high because of the factors that I mentioned before. And it's also to make sure that when you do the measurement again, has it actually improved? Because if it hasn't, you need to adjust your program, adjust the interventions. And I think this is the kind of thing, Anne, that I wish we had many years ago. Because imagine what we could have achieved by now. But the reality is the technology wasn't there. The capabilities, the research wasn't there. But what we've done is we've brought it all into one program to actually be able to deliver that and assist clients with that. We then convert that into a payroll waste, because the more time people spend on all these issues, the more productivity is lost. And we actually then apply salaries at each different member profile, the hours wasted, to come up with payroll waste as a measure. And in this instance, you can see 7.9 million rand every month because of payroll waste. Again, the important point is not the actual number, it's relative from one measurement period to another. Are we actually achieving success? So your question is, so once we've done this, what can we do? Well, the good news is, if you look at in front of you, you've got some documents, and inside, we've actually got some brochures around the Alexander Forbes Financial Wellbeing Program. This is a program that's been designed with specific interventions and provides support and capabilities for employers, for funds. Through the Human Resource Department, it helps individuals navigate through and trade off various issues. It provides them with the necessary tools, interventions, but very importantly, it works together with the schemes that you've put in place. It needs to work with the retirement fund that you've put in place, because that becomes the base for members to have flexibility to improve their contribution rates. Your medical scheme, what options they're on to make sure that that is optimized throughout the individual's journey. So I think take some time and read through this afterwards. There's also our team outside, and if in the venue you also saw there was a booth there. You can actually see what individuals would get to engage with them to improve financial well-being. I would definitely recommend spending some time. But if you are pressed today for time, definitely speak to your consultant, to take you through this a little bit more. But at a high level, these are some of the elements that you can actually implement in the workplace. So let's have a look at this specific employer, Acme Inc. So they then discussed what they need, what the issues are. Clearly, we're not in a good state, right? So we need to have a look at targeted interventions specifically for them. So here you can actually look at various interventions. There's a well-being program. We've got on-site debt counseling. So at Alexander Forbes, we've partnered with various providers, just like we do with your group life insurance, looking at the best medical schemes out there, etc. We've sourced the best vendors to help you with debt counseling, with debt training, and make that available. And we're doing continuous due diligence to make sure that those are the best out there. You can also have, we're making available financial well-being consultants. So that's essentially a support mechanism through the Human Resource Department to help individuals as life changes for that. We're looking at various communication campaigns that tailored for your specific schemes. And then we've also redone our entire member education services to make sure that it focuses on improving financial courage. Look at the psychology behind finances and improve that. We also sourced psychologists to actually train our staff to look at what they need to do. And that'll be a continuous learning in the organization as well. By putting those things in place, you can see the impact these things can have. And some of them are more material than others. But I think we've got there's a full spectrum that you can look at. On the one hand, what improves financial well-being? Investing in people's human capital, reskilling them for the new economy, for what we're seeing as the fourth industrial revolution. So, we'll be announcing something quite exciting towards the end of the year around that, but no longer will we just be focusing on retirement funds, healthcare. We're looking at the overall employee benefits, including human capital. And I think through the partnership with Mercer, but B, some other arrangements that we've put together, we'll be announcing that in the next couple of months as well. Something we can announce today is in terms of money management and access to debt counseling. Through the financial well-being program, in the brochures that you see, we actually help people manage money through the psychology, improving financial courage, and we get the access to best-of-breed debt counseling and debt solutions. And we are looking, obviously, to enhance that over time, and we'll let you know when more enhancements become available. Through our member education services, you now have additional support to improve financial courage, and I think we've done some really good work there. The other thing is, through the workplace, you do need to make sure people have some shock absorbers to deal with emergency finances, etc. You do have that option available through the employee benefit platform, through things like tax-free savings accounts that are priced at institutional levels, etc. But then more importantly for people in the audience today, there's a whole range of things that you can do. And you've started seeing all these elements come through the last couple of years. Contribution defaults, just having a fund in place actually improves financial well-being. So I think we've been doing a lot of those, and you've been doing a lot of those good things. But it's also now not just about a one-size-fits-all, but using behavioral finance to what other contribution categories can we do? For example, automatically escalating those at pay date with individuals. Anne talked about the risk-benefit structures, how they've become more individualized. In terms of investment defaults, you've just seen, we've just changed our approach to the Alexander Forbes living investing approach, which integrates advice into what we do. We've made available to clients goals-based life stage, which is the start of the journey. And again, there's 2 options still coming the remainder of the year, but I'll leave that for then. And what's interesting is you've already seen how the industry's changed. How many funds had preservation options attached to them just 3 years ago? Very few. Very few. You might have had a paid-up section, but definitely not a preservation. How many would have had annuity defaults in a defined contribution arrangement? Almost none. There were maybe the progressive funds, yes, but now you've got that on your umbrella funds, on your retirement funds, through initiatives to the National Treasury. It's not, and it recognizes that the line between the institutional and the retail market is blurring, and the workplace is a very important place for that. And just to end off, it's very important then looking at the interaction between all of those and things like your medical aid coverage, because if you can address things there, it helps with your retirement. They need to be managed together. And an example is absenteeism management. And that's becoming quite relevant today because of people are stressed. You know, if you get out of here today, hopefully I haven't stressed you, but people are stressed. And because of that, it impacts their health, it impacts health costs, but it's impacting, you'll see it coming through in your turnover rates at employers. And as trustees, you're going to see it come through in your disability claims, and hopefully not death claims. It depends on what the issues are over there. But it's very important during these trying times to focus interventions on that, to address that. And just to close off, this just summarizes then implementing your strategy. We've now made sure that we look at not one size fits all, it's a customized approach. And we've brought together all the various elements from healthcare consulting, short-term, and then your traditional retirement and consultant and administrator, and it's all around the needs of individuals. So I would strongly encourage you to unpack a lot of these concepts with your consultants, but also please feel free to chat to us after the session and how we can help you. Thank you.